Dr. Paul, this is Nurse Mihira. I'm calling about patient 427, admitted yesterday with acute abdominal pain and suspected appendicitis. Initial tests were inconclusive, but her condition worsened overnight. She's presenting with fever, increased abdominal tenderness, and a rapid heart rate. We've administered 4 fluids and pain medication, but her vital signs remain unstable. We've scheduled an emergency CT scan to rule out complications like peritonitis or abscess formation. And Dr. Paul, I'm concerned about her blood test results. Her white blood cell count is elevated, indicating infection, and her kidney function tests are slightly abnormal, possibly due to dehydration or sepsis. We've initiated broad-spectrum antibiotics to cover potential bacterial infections. I've also increased her 4 fluids to address dehydration.
I understand you're uncomfortable with a cannula, and I appreciate your patience. However, as per our treatment protocol, it's crucial to keep it in place until you recover after surgery. Removing it prematurely could lead to complications such as infection or difficulty administering necessary medications. Mihira, your doctor has carefully considered this decision, and it's essential for your overall recovery. For your information, let me explain the importance of cannula. The cannula is essential for your treatment and recovery. It allows us to administer anesthesia, pain medication, and antibiotics directly into your bloodstream during and after surgery. Additionally, it's crucial for fluid management to ensure you maintain proper electrolyte balance and receive necessary nutrients. In case of any emergency, the cannula also enables us to quickly provide any critical medications or blood transfusions you might need. If the pain persists, we'll continue to explore other options to ensure your comfort. Your well-being is our top priority, and we're here to support you through this process.